Hi, I'm Dr. Tom Dawson. And if you guys have made it to this 4-month checkup, well then you guys are old pros now. So things have bound to have gotten a little easier. Hopefully the last 2 months was a little easier than the first 2 months. You have a little bit of routine that you can count on, a couple of naps a day where maybe you can catch up on your sleep a little bit, and things should be going a little bit better. Even if your child had colic, normally colic resolves by the 3rd to 4th month. And if you feel like your child is still having trouble with that, it may be worth mentioning that to your doctor. But in general, everything should be going a little bit better. We talked about sleep last time, and I told you in children under 4 months, if they wake up at night, I feed them. Well, now that you're at 4 months, almost all 4-month-olds can make it through the night without any calories. Now, that doesn't mean that you can't feed them if you want to. I got a ton of moms that their baby will wake up and they'll eat in 10 minutes and go right back to sleep. And that's easier for mom right now. And she just wants to keep that system. That is totally fine with me. I know with our first, we were getting up with her once a night until she was 15 months old. That's primarily because we were young and stupid. But the point is, you can get up with them and do whatever's best for you. There's not a particular time that's better for your children, developmentally. The problem is there's about 25% of babies that just sleep through the night on their own and don't have to be sleep trained. And the other 75% of us are just hoping that we're going to be in that 25%. But that doesn't always work out. So for the other 75% of us, that means we're going to have a sad week where we have to sleep train our children. And it's going to take a week because for the first 4 nights, your baby will keep up in the ante and protesting a little bit more just to see if you guys are tough enough to make it through the whole week. But if you can make it to the end of the week and all of a sudden you get a full night's sleep and in your life you see that the grass is greener and that the sky is bluer and you realize this was something maybe we should have done a long time ago. I can say from personal experience that you're not doing as well with no sleep as you thought you were. I thought during residency that I was doing fine, that was a perfectly nice human being. And then about 3 weeks after residency, when I kind of got caught up on my sleep a little bit, all of a sudden the grass was greener and the sky was bluer and I was a lot nicer person. So you may not be doing as well on interrupted sleep as you think you are. So you might consider sleep training a little bit earlier instead of later. I can tell you that I've been through this thousands of times. And even after a week of sleep training, those babies all still love their parents until they're 13 years old. So it's going to be worth it. Just going to be a tough week when the time comes. The next thing I wanted to talk to you a little bit is about their development at this age. And now they're starting to get a few more skills. Their eyes work better. They should follow you smoothly with their eyes as you walk across the room. Their ears are going to be better. Now, when you call their name, they should turn to their name being called. Having said that, they'll only turn 1 time out of 5. The rest of the time, they're going to ignore you. But if your ears work 1 out of 5 times, they work the rest of the time, too. They should smile at you sometimes even before you smile at them, which is kind of fun. They should be able to push their chest up off of the floor, and some will even be rolling over. The old books will all indicate that they should all roll over because those were written back when children were sleeping on their tummies and it was a little easier to roll back then. Now that children sleep on their back, there'll be a lot of children that aren't rolling over until they're 6 months old. The biggest thing to happen developmentally, though, is all of a sudden their hands will work. They spent the first 4 months with their hands pretty much in a fist all the time. You can find, crumbs and fuzz from 2 days ago sitting in their hand. But now that they realize they can open them, they start to use them. And so they'll grab your hair and your sunglasses and those kind of things. Don't expect them to be really good at this yet. Think of it as if you were at a construction site working the crane for the first week. You would understand that the controls and the bucket of the crane were connected, but it would take you a while to get good at it. So likewise, they're going to miss what they're aiming at some, but they'll get better and better and better at it. So we talked about feedings at night. Let's talk about the daytime some. We had mentioned that we usually don't start fruits and vegetables in children under 4 months because by doing that, we make them less likely to develop food allergies. And it's just a small portion of children that are going to have food allergies, but we don't know which ones they are, so we do it for everyone. But now that they're 4 months, between 4 and 10 months is actually the best time to introduce new foods and what we call antigens to their system to make them least likely to develop food allergies. So my normal rule is just one new food per week, so that if they do have some trouble with either a rash or vomiting or diarrhea, you'll know which food caused it. If we start with succotash, it's a little hard to know which one of those was the cause, and we have to go back and kind of start all over again. So 4 to 10 months is the best time, and mainly just one new food per week. We talked some before about rice cereal being the best source of bioavailable iron for babies. So I would like them to take a serving of rice cereal once or twice a day from now until the time that they're 1 year old, regardless of what other things that they're taking. If you haven't started vitamin D by now, it's a good time to go ahead and start that. The fluoride is something that we learned is it makes the enamel of your children's teeth harder. And so it was added to the most city water supplies probably 60 years ago. And since it's been introduced, it's reduced the number of cavities in children by like a third. So it's been very successful. And to ensure you get the fluoride you need, they need to get about 8 ounces of water a day for the next 7 years. So don't worry if you miss a day. That's 2,500 days between now and the time they're 7 years old. Missing a day or two won't hurt. It doesn't have as much an effect on their baby teeth actually as it does on their adult teeth, and that's why we're taking the fluoride. While we're talking about teeth, these next 2 months, they're going to be the most common time for their first tooth to come in. That will frequently be preceded by 2 months of drooling and chewing, and it won't necessarily be a painful 2 months, mainly wet from all the extra drooling. If your child doesn't get a tooth, don't worry. I have tons of babies that don't get their first tooth until they're 15 months old. And actually, I wish they would all wait until 15 months because really the older they are and the easier it is for them to deal with the teething. Not having teeth is not important in terms of what they can eat. If you've ever had your finger in their mouth when they chomp down with their gums, they can get plenty of force going with their gums to eat anything they need to. The only thing you need teeth for is probably if you're eating, an apple or something like that, but they don't need teeth at this age, so don't worry about that. From a safety standpoint, now that their hands work, we have to worry a little bit about the things that they're putting in their mouth. And so this is where choking objects becomes a bigger issue, primarily little toys from sometimes their older sibling. A good rule of thumb is anything that will go into a paper towel roll is probably too small to be around your newborn baby. So let's avoid choking objects. Fortunately, right now, they can't move around very much, but this is a good time to start looking at our house and childproofing it for small objects. As I mentioned, if you're interested, I have a written handout that covers a lot of these issues and summarizes and adds a few other concerns that you can get off the website if you want to print that out. But otherwise, I'm glad things are going a little better, and I look forward to talking to you in 6 months.